Hey guys, today's topic is frozen shoulder. It is also known as adhesive capsulitis. So basically, it is mainly asked in 5 marks or in Viva part. And make sure that in final year, if you are writing, you're not just focusing on PT management, you have to also mention clinical part in few points. Okay, you have to write few points about the clinical part and then you have to begin about the PT management. So here I am just showcasing you few, you can say a few sample of it, how to basically write the whole answer. So let's begin. Definition: it is a progressive painful restriction of all movements at the shoulder joint. Etiology: so it is mainly seen in the 40 to 50 years of age group and the cause is not known, right? Predisposing factor: so it is very commonly seen if a person have diabetes, if the person have underwent a mastectomy, any rotator cuff tear, rotator cuff tendonitis or bicipital tendonitis. Tendonitis is inflammation of the tendons, right? And it is also commonly seen in the विंटर सीजन. अगर आपने देखा होगा फ्रोजन शोल्डर बहुत कॉमनली ज़्यादा विंटर्स में दिखते हैं. अगर आप क्लिनिकल प्रैक्टिस कर रहे हो सो यू विल नो दिस आइडिया. Next thing is clinical features. So what would be patient complaining of? So patient will be having pain, patient will be having stiffness, reduced range of motion at shoulder joint, and there would be tenderness over the shoulder joint line, right? If you have extra time, you can also mention about the chief complaint patient would be having. So you can write that patient might be having difficulty in overhead activities, patient might be having difficulty in combing heads, dressing, undressing, tucking in the shirt, right? You can mention only if you have extra time for it. Next is diagnosis. So mainly people say that you have to write special test, but in frozen shoulder all the special tests will be positive. So there is no particular special test you are doing. So for this, diagnosis is done by Codesman criteria. You can Google it out. You can just read in detail about this, that what is Codesman criteria. I had mentioned few points about it here. That do write this. This will definitely give you an extra marks. So here it says that if the patient is unable to sleep on the affected side, there would be pain and restriction during external rotation and abduction during both passive movement and both active movements. X-ray would be completely normal in the frozen shoulder case and all the special tests would be positive. Now once you completed this many points, you can start with the PT management. Okay, so first thing you have to write is goal. So in this, the patient will be mainly having pain, so you have to reduce the pain and improve the range of motion, right? And you can also mention about the strength, that you have to improve the strength. So first thing is to relieve pain. So how we will mention is, always write the modalities and you have to also mention the time you will give, the frequency, the mode, which mode you are giving on it. Okay, you have to write in detail about it. So first thing I have written is moist heat pack could be given, SWD could be given in a continuous mode, ice pack could be given, ultrasound over the continuous mode on 1 megahertz could be given, tens, then high tens can be given, right? So you have to, for example, if I am taking ultrasound, then you have to write that ultrasound placement over the shoulder joint line, over the pain, time 5 minutes, frequency 1 megahertz, mode continuous. So you have to write like this in detail. Okay, now you can also add this point that all these modalities should be given before the exercise. Why? So because it induces the relaxation, right? So first was to relieve pain, second is mobilization could be given. So in this you have to write patient position, there is supine position, hand would be in abduction and slight elevation, then write the glides. Okay, if you have time you can explain each in detail, but you won't be having so much of time, so just mention the glides which you can give. So like distraction could be given, anterior glide would be given and it would be given to increase the extension, posterior glide to increase the flexion, inferior glide to increase the abduction range. Why here it is opposite? Because of the concave convex rule. Also mention the grade. So you have to write Maitland grade 1 and 2 could be given for pain relief and increasing the range of motion. So you can in short you can write like this same as it is also, it will be good, give good enough marks. Now third which could be given is Codman pendular exercise. Codman pendular exercise includes Codman circle, forward and backward movement of the hand and side to side movement. So you just explain the procedure that patient position would be standing, will support on the table with one hand and will ask the patient to bend forward and will allow them to do this free movements, right? There is circle, forward, backward and side to side. Now if you don't have time, you can just simply write in this manner and draw, because drawing always given additional extra marks. In progression you can write this thing that in progression we can go for dumbbells. It can be added with the we can start with the minimum weight and then we could increase the weights, right? Fourth is we can go with assisted active exercises, which includes the first one is which is commonly seen in the clinics, right? We all have seen, so it is very easy to write. First is pulley. So in pulley you can write for shoulder which all movement would it improve. So you have to write for shoulder, flexion, extension, abduction and adduction would be improved by it. Repetition, so you can write 10 to 15 repetitions. Patient position could be either sitting or standing and just simply draw and show the movement. Okay, it would be very helpful and very easy to write. Next is shoulder wheel could be given. So if it is to improve the circumduction, that is the range of motion, right? All range. So you can just simply draw. Then finger ladder could be used to improve the flexion and abduction range. Then you can go for wand stick. With wand stick we improve all the movements, right? You can go for it twice a day and you can write the repetitions 10 times. Okay, next important thing which we give is stretching. So therapists can give stretch at the end range of motion in a particular direction. Okay, or else we can ask the patient to do self stretching. So if we ask the patient to do self stretching, we can go for internal and external rotation, like standing on the doorway and just flexing the elbow, and we can go for that. Okay, we can write this towel stretch, we can draw that, which we do in the clinics, right? We can write we have to mention this thing, we have to write hold, that you can go for 30 to 40 seconds hold, and repetition 3 times at least. Okay, 3 to 4 times you can go. And last thing is we go for strengthening exercise. So strengthening could be given, just explain in detail if you have time. If you don't, just write in small that by manual resistance you can apply. You can go for dumbbells, you can go for kettlebells, therabands and tubes could be given. As well as you have to write that all the shoulder muscles can be strengthened for scapular, which is why Blackburn exercise could be helpful for it. Okay, scapular muscle, to strengthen the scapular muscle could be Blackburn exercise is helpful, right? You can just mention it. And the last and very important thing is home advice. So do mention these points, it would be helpful. We can ask the patient to not sleep on the affected side, use cold packs for 10 minutes 3 to 4 times a day, right? We can ask them not to carry any heavy weights or any heavy object, or lift or push or pull any heavy objects. Okay, and we can ask them to repeat this same exercise once at a home, right? So this was just a sample idea that how you have to write, how short you can do, and you have to do about, it's all about time management you have to do. So yeah, that's it for today. Thank you guys. I hope it is a helpful video to you. Thank you.